Good evening and welcome to our second virtual medicine for members. We would like to thank our members for the very positive response we have received after we piloted this new online format. We have evolved somewhat since then, and we are now hosting tonight's lecture as a webinar, where members are now able to join the live as attendees and will be able to participate via Zoom as well as Facebook in the live Q&A at the end of the talk. Tonight, we are very excited to have Dr. Riaz Kayani, consultant in pediatric intensive care and organ donation lead, join us to discuss organ donation in 2020 with our host, non-executive director, Mike Napton. So without further ado, Mike, thanks so much for joining us.
Nikki, it's a great pleasure, and very warm welcome to everyone, both on Facebook and on Zoom. It's lovely to, if not see you, know that you are there. And welcome to our second online medicine for members. These are held on a regular basis to keep our members and the public informed about what the hospital is doing and how it's innovating and developing. And I'm delighted that tonight we're going to be able to talk about organ donation. And it couldn't be a better week to do so, because this week is Organ Donation Week, which maybe Riaz will talk to us about. So the title is Organ Donation in 2020, Successes, Hopes and Challenges. And Nikki will, I'm sure, confirm this, but we are recording the meeting tonight, and this will be available for people to watch again or to share with your friends and family if you want them to see it too. So Riaz, Dr. Riaz Kayani, I know well. We meet on a regular basis at the Organ Donation Committee at Addenbrooke's Hospital. Riaz has been a consultant in paediatric intensive care since 2014. And he's currently the lead for organ donation at Addenbrooke's and has been looking after the organ donation activity since 2016 as the clinical lead for organ donation, affectionately known as the CLOD, which I think is quite a good name. And I think what you're going to cover off is both not only the work of Addenbrooke's Hospital, which has been very significant in this area, but also regional and national issues, not least the fact that the law with regards to organ donation has changed. So Riaz, delighted you could join us and take us through organ donation. Over to you.
Right, I'm just going to share my screen. See if I can do that without any problems. Okay, can you see you can see the slides, hopefully?
Sadly, no, but maybe.
Oh, no, oh, okay, let's see.
Excellent. There we are.
Yeah.
Thanks.
You can see them. Okay. Right. Okay. Yeah. So my name's Riaz Kayani. I'm the clinical lead for organ donation at Addenbrooke's. And what I was going to do, hopefully, is give you a overview of organ donation in general and some of our local activity. So thank you very much for asking me to speak, and welcome, hopefully, welcome to all the members. So I know that I'm speaking to a very diverse audience, so I'm really going to start at the beginning, and we'll see where the next few minutes take us. What is organ donation? Very simple first question. So really, it's the act of giving an organ to save or improve someone's life who needs a transplant. And my speciality and my expertise really is in deceased donation. Obviously, it is possible to be a living donor. You can donate your kidneys or kidney and part of your liver. But the vast majority of organ transplants in this country come from people who are deceased. I mean, I still think organ transplant is really a kind of a medical miracle, really. And the combination of the fact that you can offer hope to recipients and families in the midst of someone else's tragic loss is really a kind of a unique situation, and really the reason that we do our job, really. The timing of me talking to you is not completely by accident. It's Organ Donation Week this week, and Organ Donation Week runs 1 week every year. and really to promote awareness of organ donation and get the conversation about donation going. So what we're really wanting to do this week is get people talking about organ donation to their family, to their friends, over the dinner table, over the breakfast table, and really kind of increase awareness of organ donation. And particularly this time, we are bringing to the fore and want to increase awareness of the law change. And many of you will hear or have heard of Sankiras Law, which is coming in May, which is a change to organ donation in this country. And I'll talk obviously in a bit more detail about that, but that's what we're going to be hopefully talking about and highlighting today. As you can see from the picture, we have lit up the big chimney stack at Addenbrooke's all week this week, every evening, really kind of obviously to promote awareness, to celebrate the contribution of donor families, obviously without who we couldn't do our job. And obviously the clinical team's working very hard in these very challenging times. And in addition to lighting up Addenbrooke's all week this week, we're going to be lighting up King's College on Thursday, and that's associated with a short walk. Some of the nurses are going to be doing a social distance walk from Addenbrooke's to King's College. So why organ donation? Why is it important? So the thing that we mustn't lose focus on is that there are about 6,000 people in the UK seriously ill who are awaiting a life-saving organ transplant. And the impact of it has been huge. I mean, there are 50,000 people alive in the UK who benefited from the generosity of organ donors in some way or another, either from solid organs or tissue. And also what you mustn't lose sight of is that, you know, unfortunately, there are people who don't receive the organ transplants they need. And last year, 372 people died while on the waiting list, and another 746 were removed from the list because of deteriorating health and weren't fit enough to have a transplant. So it's a huge problem, and it's really important. So it really kind of emphasised the importance of organ donation on both sides. Okay, so the truth is, though, that not everyone can be an organ donor, and unfortunately, actually, very few people die in circumstances which allow organ donation, which is why that kind of gift of organ donation is even more precious. And if you consider the fact that 600,000 people in the UK die, but only 300,000 of those die in hospital, and obviously that's a big precondition of being an organ donor, and you have to die also in an intensive care unit. So the end of life can be controlled. And so actually when you go through the amount of people that unfortunately do pass away, then the actual number of donors, once it's sort of whittled down to people who are eligible and then people, families who can consent, actually, there are about 1,600 donors in the UK every year. And that's associated on the other side with around 4,000 transplants. And one of the important things, obviously, with deceased donation is that we have to kind of mention that obviously these are from people, unfortunately, who have died. I'm not going to talk too much about that. I'm not going to talk too much about end of life, but I just want to reassure people that we do have strict definitions of how we go through end of life and death, and the way that we look at death is either from a neurological point of view, or in other words, neurological function, and what we call by cardiac criteria, which are looking at the circulatory system. But as I said, I'm intentionally not going to dwell too much on that. But it is important to recognise that, I mean, there's organ donation, and there are a whole variety of things which organs that are eligible for donation. So obviously heart, lung, people know about pancreas, liver and intestine, and those of you who know the activity at Addenbrooke's know that the whole combination of those things can be transplanted at once. But also tissue donation is extremely important, and so corneas, heart valve, skin, bone, veins, and ligaments can be donated. And I'll talk a little bit about innovative things also that are kind of being added to the list as we speak. But you can see from that an organ donor is an extremely precious thing, and it's an incredible gift to be able to give, and it is possible to actually contribute to the lives of 9 people by being an organ donor, and even more if you were able to become a tissue donor. But I mean, why do people go become organ donors or kind of sign up to the register? So there's in general in the UK, there's a very strong support for organ donation. And one of the important things to emphasize really is that it really depends on the generosity of donor families. I mean, all of us are constantly struck by the bravery and generosity of families who act in this way, this generous way, really what is can be the worst time of their life, and they think that the way that they respond to that is to give this incredible gift. But what we do know, though, that organ donation itself can be a comfort to those families, and the knowledge that actually they can contribute to someone's life and commit to a life-saving act is a great comfort to them. And we know that from talking to donor families again and again, which we do on a frequent basis. There are many, many positive stories around organ donation, and I won't read this out to you. I'll perhaps let you read them in your own time. But many, many people say to us that, you know, that unfortunately a person is involved in an accident or something which causes them to unfortunately die. That during this time they remember the fact that this person was a kind and caring person and wants to help people. But also, you know, through the process of donation, it actually can help families come together, and it can help. And it can increase the amount of time that families are able to spend with their relatives. And you can find online on the NHS BT website lots of wonderful stories about the positivity that organ donation has brought to families and help them through their grief. So at CUH, we have a very long and proud history of being one of the highest donation trusts in the UK, and it's been for many years. And last year, we were able to consent 57 families for donation, meaning that 103 patients received life-saving organ transplantation. As well as in donation, we're a world-leading transplant centre, and amongst many things, we were the first in the UK to do multi-visceral transplants, and I think that this week we were celebrating 20th anniversary of the first multi-visceral transplant. There's lots of transplant activity. There were 191 kidney transplants, 90 kidney and pancreas transplants, 95 liver, 13 bowel transplants, in total 323. And we're particularly lucky, I think, in Cambridge and in the area, and that now, because of the move to Papworth, to the biomedical campus, we now have a leading centre of heart and lung transplant on the same site. And collectively, there are many examples of world-leading innovation, the most recent of which is something called the Dcd Heart Program, which is a way to increase the amount of donor hearts available by targeting patients who've actually hearts have stopped and then being able to donate after that. So I think we have a lot to be proud of at Addenbrooke's. So the organ donation team, I'll just talk about quickly. So there's a whole group of us. I mean, the clinical leads, who myself and Andrea, who's recently been appointed, Mike Napton as the chair of our committee, but the real kind of bedrock of the organ donation work is the specialist nurses. So at the moment we have 3 embedded nurses, at Addenbrooke's, and those numbers have fluctuated over the years, but I mean, essentially they're highly trained nurses who often come from a background of intensive care or emergency, a whole variety of different backgrounds, but they're specifically trained in communication and family support, and particularly their expertise lies in end-of-life discussions and conversations. And they're excellent at being able to explore decisions and explore people's wishes around organ donation and kind of tailor the care to individuals. And also that what they kind of really excel in is being able to form relationships with families, and they like to be involved in the life care and the intensive care. I should say they're actually not part of the intensive care itself. They're actually supported by NHS Blood and Transplant, and they come in once a potential donor has been referred to them. So really kind of our work is undercut by the facts that we know that the vast majority of people in the UK are in favour of donation. but only 30% or so join the organ donor register. So in previous years, and kind of, throughout really my time as CLOD, we have, been working hard to get people to sign the organ donor register and done various kind of activities around the hospital to try to get people to sign the organ donor register, knowing its importance. And really kind of that came in the 90s. And really what we have always wanted to emphasize is that you should make a positive decision about what should happen after your death, and whether you would consent or give your permission for organ donation to happen. It's actually very easy to join the register. It takes a few minutes. You can do it online, you can do it over the phone, someone will guide you through. But part and parcel of doing that in conjunction with that is really, really important to tell your family what your wishes are, so that your family knows and your relatives know and people around you know what your decision is. Because that really kind of affects how we're able to talk about end of life with families. And so I'll come on to that in my next slide, but we're actually pretty good. I mean, 41% of the population of East London has joined the register, which is above the national average. So congratulations to you all. It is, though, really important, particularly in the kind of, the current place we're in with social media and everything, it's not to be swayed by disinformation about organ donation and joining the register. So it's really important to know that if you do sign up or you do consent to organ donation, that we still have a duty of care to you, that everything will be done if something were to happen to you, that your life will do everything in terms of life-saving treatments for you, that won't be limited at all. And organ donation is only discussed once those attempts or those treatments and therapies have been exhausted. We have very, very strict rules about how we confirm death, and they have to be objective and have to be repeatable, and that's extremely important to us. Every donor and every patient is treated with dignity and respect, and particularly when people have concerns about how the donation process works, and have concerns about organ retrieval and funerals and things like that, is we have the same standards of respect and care that we have with everybody else. Also, nothing happens in isolation. We always talk to family about what's going to happen. And it's important to remember that there's no deadline. That was a bit of fake news that came out. There's a deadline to join the register. That's certainly not true. And there's no kind of market in organs. No one profits from organs in the UK. There's no personal incentives for me or anyone else from the organ donation team to promote organ donation, except that we want to try to help recipients and people who need organs. It's extremely important to tell your family what your wishes are, and particularly around the end of life discussions, and it makes that conversation a lot easier for all the hospital staff and the people, especially the specialist nurses, that people know and your family know what your discussions, what your choices are. You have to also remember that there's many people that won't want to donate, and those wishes will always be respected and will always be honoured. So what are the barriers to donation historically? So there have been kind of two major pieces of work to try to boost donation in the UK, and Cambridge has been very much part of those. And in 2008, essentially, the major thing was to make organ donation a normal part of end of life care and a routine part, along with the various other strategies that worked extremely well. And our current strategy, which is kind of coming to an end, is very much focusing on consent, increasing the consent rates, and increasing the effect on culture and society and their acceptance of organ donation. And has that worked? Well, yeah, certainly it has worked. So we've seen a doubling in the number of deceased donors since 2008, and that's kind of nationally, and that's tied very closely to those two pieces of work. And we can see that that's had a knock-on effect on transplant. So year on year, we've seen an increase in organ donors and a 67% increase over the last 10 years. And that's translated to a 49% increase in transplants and a 24% decrease in the waiting list. So it's had profound effects on both donor numbers and transplants. And really, the next thing really is to work on the fact that we, on a world stage, we're doing extremely well, and we just want to get better. And we really want to kind of be able to say that we have a world-class both a donation and a transplantation setup. So the law has changed, and the next part of my talk will be a little bit about that. So many of you will have heard of Sankiras Law, And Kira was a child who unfortunately died in a road traffic accident and became an organ donor. And Max was a child who had a dilated cardiomyopathy and needed a heart. And so there was a tie-up between donor and recipient, and the law initially was going to be called Max Law, but a very great idea to honour the donor in that as well. So that's been a process probably, I think, over about 5 years. I think Theresa May's government, was the government that passed it, and it came into law in May 2020. There's been a great deal of publicity around it. Unfortunately, some of that publicity has been overtaken by COVID, but there's been a lot of publicity about it. Particularly the Mirror has been one of the newspapers that have really kind of worked hard to increase awareness of donation in general. And Max and Kira's law came into statute in May. What it says is that essentially all adults will have agreed to donate their organs when they die, unless they record a decision to not to donate. In other words, they opt out. It does have exclusions. Anyone under 18, so it doesn't apply to children, doesn't apply to people without the capacity to understand the law, and people who are not resident in the UK, if they haven't been living in the UK for, have been living in the UK for less than 12 months. And the first question obviously will be, how does that affect how the organ donation process works? How does it affect how the specialist nurses work? So we don't think that actually that differently. I mean, families are still very heavily involved in decision making around organ donation, but if you sign the register and you give and you tell your family what to do, it makes that decision and it makes that conversation much, much easier. In other words, there's no confusion. If an individual hasn't expressed what they want, then the nurses will speak to their loved ones in the same way that they did before and try, based on what their loved ones would have wanted, they will make a decision collectively as to whether organ donation will proceed or not. It's still extremely important to remember you still have a choice, and any decision against donation or to opt out will be respected. So there's absolutely no pressure at all if you decide that, or the family decide that they don't want to do that. But what we are really hoping by this law is it will take that confusion away, and it will take away really those numbers, those opportunities that are missed because families don't know what you want. Because I'm a paediatrician by trade, I should also tell you that children can be organ donors. Obviously, the death of a child is a very tragic and a rare and tragic thing. But there are 27 pictures in the country, which Cambridge is one. Over the last 6 or 7 years, there's been a big increase in potential donors for children. We have 56 donors a year in the UK, and 183 children are still waiting for transplant. So it's obviously still a shortfall, and that's really been done by a combination of benchmarking against adult practice and research and standardization of procedures. Obviously, I have to talk about COVID. Unsurprisingly, I mean, COVID has a dramatic impact across the whole NHS, and organ donation, of course, it's had an effect, and it's caused a sharp reduction in organ donation activity and a knock-on reduction in organ transplants. Primarily, I mean, people who have either died of COVID or suspected COVID unfortunately can't become organ donors. And there are also obviously other issues around hospital capacity, intensive care, immunosuppression of patients going on to transplant lists. So for a whole variety of reasons, activity has decreased. But what's really reassuring actually is in the fact that despite the pandemic, organ donation has continued. I mean, at CUH itself, we've had 11 donors over that time. And in the UK, we've had 95 donors. And it really is a kind of a testament to many things, particularly, I think, donor families and their kind of commitment to organ donation. And also to the clinical staff who kind of work tirelessly to make sure that organ donation continues through the pandemic. So what does the future hold for us? So really what in the short term, what we want to do is that obviously we want to have a phased reintroduction and a phased increase in deceased donors and transplant activity. And at the moment, all the transplant centres have reopened, and we're working really hard to get transplant activity back to pre-COVID levels. Even though the opt-out legislation has already gone in, and in Scotland is going next year, and Wales having gone in 2015. There's a real focus this year on inclusion and diversity, especially in the BME community, because they're disproportionately overrepresented in being on waiting lists for organs, but disproportionately, there's a disproportionately low number of organ donors. So that's a real impetus for this year and continuing on. What we want to do is kind of improve both donation and transplantation to make UK really a world-leading service. Particularly in Cambridge, we have a strong culture of research and innovation. We want to support that. But really what I want to do lastly is really kind of talk about, as none of us really can do anything that we do without the bravery and the generosity of donor families. And for us, really, it's a real privilege to be able to work with them. And what we want to do, obviously, is continue that strong bond and the long record we have of organ donation, really. Good, yeah, I just want to say two things. So I'm going to just thank the donors and families. I want to thank all the organ donation team. I want to thank my predecessor, Ron Bernstein, who kind of taught me pretty much everything I know. At NHSBT and the comms department, thank you very much for helping me for some of the slides. And I also want to make a personal thanks to all the intensive care staff in the hospital. Thank you.
Well, Riaz, we thank you for a tremendous presentation. We need to get your presentation out of the way, and then we can go over to some question and answers. And I think, Nikki, you've got the sight of the questions that people are submitting, and so I'm going to hand over to you to manage those questions. But from me personally, thanks, Riaz. Great presentation.
Lovely, thanks, Mike. And I just want to remind all of those attendees via Zoom that you're welcome to ask any questions through the Q&A, and hopefully you can see where to do that. And we will get to those questions as well. But just some that have come through from Facebook. There's a lovely one from Gail, who's asked, how long do you have after confirmed end of life to harvest organs? And is it because you can't match tissue with a window of time that you don't take any more or all organs?
No, well, there is a kind of standardized process during end of life. And it depends a little bit on, again, what I was talking about in terms of how we diagnose death and whether we do it from neurological criteria or kind of criteria. But again, I don't want to get too bogged down in those details, but essentially there's a process by a potential donor is identified and referred to specialist nurses. The specialist nurse will go in and talk to the family, and they'll talk about what if someone had any wishes before this happened, and obviously the thoughts of the family, and will if they are pro donation, then they will try to get consent from that family. Now, once they have consent, there's a process by which they coordinate with the transplant centres around the UK, and they're able to talk to those teams about the organs which potentially are available, and they will try to match those organs with patients in various centres. And there's a whole infrastructure that goes behind the clinical teams, which is run by NHS Blood and Transplant, that helps to match donors and recipients to make sure that they adequately get matched. The time taken for that is, again, a kind of multifactorial process, and some of that depends on intensive care, some of that depends on the operating theatres, some of that depends on the retrieval teams. But I think that they can be reassured that we try to match recipients to, or donors to recipients, as quickly as we can, and we still keep a strong focus on the end of life care for the donor and the family to support them through that and to minimise that time.
Lovely, thank you. And there's another one that's come through from Jenny. She wants to know, is there an upper age limit for donation?
Yes, so I'm hesitating slightly because we have recently just changed the upper age limit because of COVID, but we've just recently kind of gone back to where we were. So it depends a little bit on the method by which we classify how the criteria that we use to die, and also it depends a little bit on the ability of the intensive care units to do so. Normally what we say is 80 years old, but I mean, that is not necessarily something that's kind of set in stone, and it does very much depend on the circumstances in which an organ donor presents themselves.
Yes, lovely. And then there are two questions that have come through, one from Neil, one from Jane, who have said, so Neil wants to know, he's thanked you for the lovely presentation, and he wants to know, how has organ donation from live donors, for example, for kidneys, changed during the pandemic? And similarly, Jane would like to know, when will living kidney donations recommence?
I have to say, I mean, my expertise really is in deceased donation. And unfortunately, I don't have the information to be able to answer that question, but I can certainly find out. I have plenty of people that can tell you that information, and some of those might actually be on the Zoom call. But I'm really sorry, I can't answer that question.
Okay, well, don't worry, we will get back. We will find those answers and get back to them.
We'll find those answers out. Yeah.
And then Sarah wants to know, what is the most difficult transplant surgery and why?
Unfortunately, I'm not on the transplant side. I mean, what people should know, that there's a very clear distinction between the organ donation team and the transplant team, and that's for obvious reasons, and to remove any conflicts of interest or anything like that. So that's a question for a surgeon, unfortunately not for me. I'm not doing very well at the moment. I'm just deflecting every question.
Well, it's good to understand the difference, and obviously our audience needs to understand, as well as myself, the difference between the two. Yeah. And then one that's come through from Jasmine, how do you decide which recipients gets an organ? I'll refer you back to my early answer in that essentially there's a matching system by which, if there's a potential organ donor, the specialist nurses will be ringing a central service and speaking to the recipient centres to try to match a donor to a recipient all the way through. So there is a system by which that happens, and they have many competitions throughout the day. And then perhaps maybe one or two more. Can someone who has had a transplant donate organs?
Yes, no, they can. Yeah, I mean, again, it's on a very much a patient by patient basis. Obviously patients who are receiving organs can be very sick. They may have multi-organ issues. They might be on different drugs, immunosuppressant drugs, things like that. But it's very much on a case-to-case basis. It's not impossible.
Okay, lovely. I think that looks like all the questions that have come through. Mike?
Yeah, well, look, Riaz, I agree. A fantastic presentation and a real insight into the work that you do, which enables the work that the transplant surgeons do to save lives. The only sort of observation, I don't know if you ever go to the transplant games, but these are an annual game.
No, I've not been myself, but I do know them well, yeah.
I've been a couple of times, and they are an extraordinary occasion where children and adults who've received a transplant have been given the gift of life, so much so that they engage in an annual competition, Transplant Games, and the opening ceremony, the most moving moment, which I think reflects what you were saying about the gift of life and hope that the deceased families can give, is when they have the opening ceremony and all the participants walk in, and at the end about 200-300 transplant donor families walk in, and the round of applause and the warmth of affection and gratitude that they get is extraordinary. And what you've done really is given us an insight into the background to all that and how organ donation can lead to not only the gift of life, but help the family who've lost a loved one grieve. So I think I can't thank you enough, and it's been a fascinating presentation, and we're very grateful. And on behalf of all of those listening on Zoom and Facebook, many thanks for giving of your time.
No, thanks for the opportunity.
Yeah, and I'll see you in September, I think.
Yes, I'll see you in September.
Good. I shall look forward to that. So I think we're out of time. It's just 7:10. So just to wrap up, the only thing for me to say is to thank everyone for joining us. It's been, I think, a fascinating evening. And I can't resist saying this. If you haven't done so, please do sign up to the organ donation register. It takes 2 minutes. It takes less than the time it takes to boil a kettle. So do sign up if you can. And secondly, do let your family know what your intentions are. So, Nikki, I'll hand over to you to make the final comments if there are any.
Well said, Mike.
Yeah, thanks.
Thank you. I don't think there's anything to add to that. Thank you, everybody, for participating. And thank you so much to everybody for joining the Zoom call and for experimenting on this online sphere that we are now accustomed to. So we look forward to speaking to you all again at our next Medicine for Members, which I believe is on breast cancer. So we'll see you then.
Okay.
Thank you very much. Okay.
Good night, everyone. Have a good evening.
Thank you.
Thanks.
Bye.
Bye.